Good morning. Today we're talking about a life-threatening condition that affects children worldwide, sepsis. Sepsis, or infection that causes life-threatening organ dysfunction, remains one of the leading causes of death in children across the globe. But there's some promising news. Researchers at Northwestern University and Ann and Robert H. Lurie's Children's Hospital of Chicago have developed a new way to spot sepsis before it strikes, using our good old friend, artificial intelligence. That's right. Scientists have created and validated AI models that can accurately identify children at high risk for sepsis, up to 48 hours in advance, allowing clinicians to begin life-saving care early. What's new? This multi-centered study published in JAMA Pediatrics is the first to use AI to predict sepsis in children based on the new Phoenix Sepsis Criteria. Before this, previous models struggled to improve early diagnosis, but this study may change all that. Dr. Elizabeth Alpern, professor of pediatrics at Northwestern University's Feinberg School of Medicine and division head of emergency medicine at Lurie Children, led the study. She said, and I quote, the predictive models we developed are a huge step towards precision medicine for sepsis in children. Dr. Alpern explained that the models showed a robust balance, accurately identifying those who would later develop sepsis, without over-identifying, that's key, children who are not at risk. Over-identifying is the big thing. That balance is critical because aggressive treatment can be risky when it's not needed. So how did the study work? The study included 5 major health systems from the Pediatric Emergency Care Applied Research Network, or PECARN, giving researchers access to a large, diverse data set. Using electronic health record data, the team looked retrospectively at emergency visits from 2016 to 2020, then tested the models on 2021 to 2022 data to see how well they would perform. Now here's the key point. They only used data from the first 4 hours of the child's emergency department visit before any organ dysfunction was present. The first 4 hours. That means the AI could spot subtle warning signs that weren't even experienced They could spot subtle warning signs that even experienced clinicians might not see. Children who already had sepsis on arrival or within the first few hours were excluded, keeping the focus on true prediction rather than diagnosis. Predictive features included things like triage scores, heart rate, respiratory rate, and existing medical conditions such as cancer. Now, Dr. Alpern said the team also made sure to evaluate their models for bias, ensuring results were consistent across diverse populations. So next steps, combining these AI models with clinical judgment, blending technology and human expertise for even better predictions. That's where the future of pediatric care is heading, using data and machine learning to personalize treatment and save more young lives. So tonight on Dr. Jeff Talks About Sex and Intimacy, sexual intimacy is so much more than penetration. Dr. Jeff is joined by Dr. Susan Kellogg-Spate and Alicia Williams for a candid talk on the art and science of outer course. Remember that? Intercourse, outer course. How couples can connect physically and emotionally in new, creative ways. It's all about reducing pressure, expanding pleasure, and redefining what sex can be. So don't miss it tonight at 7 p.m. on drjeffsextalk.com. You can see it's right there. Hey, what's coming up tomorrow? Tomorrow on UroNurse News, scientists at the University of Cambridge have grown human embryo-like models that actually produce blood cells in the lab. Oh man, that could put an end to the blood shortage. We'll explain how these hematoids could revolutionize personalized medicine and regenerative therapies, and why this breakthrough might change how we study blood disease forever. Don't miss it tomorrow on UroNurse News. That's it. I'm Vic Senese. This has been UroNurse News. Stay informed, stay healthy, and as always, take care of your patients and yourself, and hey, like and subscribe.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view. UroNurse News.